This is Jennifer Kettering for You Wellness, a collaboration of journalism students reporting on the health and well-being of the University of Wisconsin-Madison campus community. My guest today is Dr. Sarah Van Orman, Executive Director of University Health Services. Dr. Van Orman and her staff are charged with promoting, protecting, and restoring student health and well-being so students can achieve their full academic potential. Dr. Van Orman, welcome.
Thank you.
In your UHS biography, it states that you were a teacher before attending medical school. I would like to know a little bit about your experience teaching and your time with Teach for America, and I'm wondering how those experiences and what other experiences that you may have had have led you to UHS in your current position.
Yeah, let me talk a little bit about that, and what a great question, actually. When I graduated from college, I had certainly done pre-med coursework, but I was always intrigued by education. I'd done a lot of teaching as an undergraduate, and so I had the opportunity to be a part of Teach for America. It was actually the very first year of Teach for America, which was a fascinating gamble, I think, that all of us took when we were engaging in that. And so I was placed as a high school biology teacher in a very, very rural community in Georgia. The town I taught in was called Sparta, Georgia. It was a community of about 2,000 people, and we taught at a county high school. There were about 600 students that were bused in from throughout the county to that high school. That part of Georgia is a very underserved area. It was a very poor, very rural area, very isolated. It was located in sort of central Georgia. And the high school was really the center of the community. It was the center of life in that county. And it was also where the students sort of centered their lives and their activities. It was a tremendous, tremendous experience. The students had many, many challenges. The unemployment rate in that county was well into the over 50%. Our students came to the school with very poor academic preparation, lots of challenges. We had 50 pregnancies in our high school that first year. But what I also found from that experience is that the students were amazing. They were bright, they were intelligent, they were trying very hard to learn academically, to make a difference, had goals and aspirations. And so I really had an opportunity to see what the power of school settings are and the power of academic settings. Not only that's where people are educated, but that's a place where people's lives are really transformed, where people are shaped, where they can learn things that help them to go on and be happy, successful adults. So I really was intrigued by the role of schools and the role of institutions in really kind of helping not only affect the students' lives, but also then change communities. And I went to medical school then. I realized that I really sort of intrigued my notion of wanting to go to medical school and addressing some of what I think were the real health issues I saw in that community as well. Obviously, there was issues around teen pregnancy, alcoholism, drug abuse, mental health, lack of access to healthcare services. There was no obstetrician in the county, for example. And so I really became intrigued about that, about going to medical school and wanting to do that. But I think that foundation as a teacher and in the classroom is really something that I carried with me as I went to medical school.
So did you always envision yourself in this type of setting, or did you envision yourself in a more clinical setting?
I was always intrigued from the perspective of I really love being a doctor and that sort of one-on-one interaction you have with patients. But I've always been intrigued in sort of the systems, the policies, the other sort of programmatic aspects that are part of actually delivering direct care. So I think those have always been interests of mine. When I went to medical school, I thought I was going to be an adolescent physician, and I always imagined myself working with high school students, with young adults. So my path took a little bit different perspective, but that's what I went into it thinking I would do.
In your current position, you oversee all the various departments of UHS, but you do continue to see patients in the primary care clinic. How does that interaction with patients help you to be a better executive director?
You know, I think for people and physicians who go into leadership roles and kind of executive roles, it's always a little bit of a challenge. I mean, it's difficult because being a full-time practicing physician requires a lot of commitment to that and availability. And administrative roles also require a lot of the same. I think, however, though, that maintaining a clinical practice, it really helps keep you grounded. It reminds you, why you spend hours looking at the budget. It's about trying to get the money to pay for the actual care that's delivered. It keeps you focused on what the real priorities are. It keeps you in touch not only with the patients that you're serving, but also, the people that are serving them there on the front lines, your colleagues, the other physicians, the other nurses, the support staff. So I think it's really important to try to keep that balance.
Okay. So in your opinion, what are the biggest health and wellness issues that face our campus?
I think there's a lot of health and wellness issues that affect both our campus as well as college students as general, as well as young adults. And some of those things are the same, and some of them are different. I think that young adults are very unique in their healthcare needs. They don't have the same needs as adolescents, people in high school, but at the same time they also don't have the same needs as adults who are maybe 30, 40, 50 years old. There's a few things I'll mention, and then we can talk about them in more detail. One is that it is a period of tremendous financial transition, and young adults between the ages of 18 and 24 are the single largest group of uninsured people in our country. The highest rates of uninsurance are for young adults. College students, as a subpopulation of young adults, are probably better insured than the general people in that age bracket, but I think college students also suffer from lack of access to insurance and lack of access to resources to pay for health care. At the same time, many of them are dependent on their parents, for example, for health insurance, and when their parents' health insurance changes or doesn't provide the kinds of services they need at that age group, it can leave with serious gaps. So I think for young adults, just as for a lot of part of our population, how you're going to pay for health care and can you get access to the services that you need is really important. The other thing I'll say about the health needs of young adults is that they are very different than older adults. When we're looking at a population of people, say 55 to 60 to 65, we're really talking a lot about the highest priority conditions are, chronic diseases, diabetes, hypertension, heart disease, really important. For young adults, that's really different. More often we're talking about mental health illnesses and prevention services are really where more of their health needs are. And a lot of health insurance plans and a lot of health programs are not really designed to look at, well, where is the burden of disease in young adults?
Okay. So according to the 2009-2010 annual report, your marketing campaign is credited with a 15% increase in the use of UHS services over last year. And so where did you see the largest increase in services that students needed?
We're seeing a really demand in all of our services at UHS. We think part of that is related certainly to our new location, so we've really moved to this more central location. And then part of it is a pretty aggressive kind of couple-year program we've had to become much more public in terms of how we market our services, how we project our image, how we make sure that we're out on campus, making students aware of the kinds of services we have. We think it's really important that they know that we're here and we're